Blue light is the thing that is your body is very sensitive to in terms of your production of melatonin. So some people will actually wear blue light blocking glasses at night. This is why you should be dimming lights in your house and avoiding screens before you go to bed, because the blue light that's pushed from this actually reduces the secretion of melatonin from the pineal gland and will effectively what's called phase shift your sleep onset, which means your sleep onset won't happen until later, which means you'll have difficulty falling asleep. All right. So if blue light suppresses melatonin, how can blue light also be helpful? So this is the question, and it's all about timing. I'm all stuffed up now. Blue light in the nighttime is bad, but blue light in the morning can actually have the opposite effect, where it helps to regulate and kickstart your circadian rhythm. So the full-on circadian rhythm is regulated by what's called the suprachiasmatic nucleus of the hypothalamus. When light hits the retina, it projects, it stimulates melanopsin-based intrinsically photosensitive retinal ganglion cells. Say that a few times. IPRGCs. These cells are sensitive to wavelengths in the blue, or sensitive to light, sorry, in the blue spectrum of the range. So when these cells are stimulated, it suppresses the production of melatonin. So again, like I said, blue light bad at night because that delays the onset of sleep. But blue light in the morning suppresses melatonin, increases wakefulness, and essentially makes it phase shifts sleep the other way. So now, because of you're doing it in the morning, it stimulates that wakefulness response, which then creates your sleep onset to happen earlier in the evening, provided you're not suppressing it later on with other, bad, unhealthy practices. So blue light therapy has become an interest in concussion patients because it has been found to reduce daytime fatigue, reduce daytime sleepiness, and improve alertness throughout the day. Blue light therapy has also been shown to be effective in treating some forms of depression, which often overlap some of these sleep difficulties. So it's become an interest of concussion researchers is how can we use blue light to potentially biohack or body hack our bodies into resetting our circadian rhythm, which has become disrupted by a concussion injury. And the reason I'm on this kick is there was a study published in December of 2019, which I found very interesting. This was one of the first randomized placebo-controlled trials using blue light versus a placebo in patients with persistent concussion symptoms. So what they did is a smaller sample, so you have to keep this in mind, but they had 34 adult patients that were randomized into one of two groups. Group 1 received daily blue light therapy. Group 2 did the exact same protocol, but their light was amber. So this is where you control for the placebo, right? Because if you give people any type of intervention, they may get better just on the fact that you're intervening. So you have to intervene with everybody, but you have to just change what the intervention is to know if it's actually the thing that's treating them or if it's just the fact that you're intervening. So this is where the amber light comes in. And both groups did 30 minutes of daily light exposure within 2 hours of waking up. And they kept this in a journal. And what they did is they had a subjective and objective measurement of sleep quality, daytime sleepiness. So they wore these wrist watches called actinographs that measured how well they were sleeping at night, measured how long they were in each phase cycle of their sleep. And then they also recorded journals of what they felt daytime sleepiness. They would do daytime sleepiness rating scales and other outcome measures. So they had those subjective measures, the reporting, and then they also had objective, which was actually measuring their sleep quality, when they fell asleep, how long they were asleep for, etc., when they woke up, all this type of stuff. So they did it before the therapy, and then they did 6 weeks of therapy, and then they were measured again on all of this stuff. Now, after 6 weeks of treatment, the blue light group had a significant phase advancement in sleep onset, meaning they fell asleep much earlier or significantly earlier after blue light therapy than they were before blue light therapy. 1 hour was the average. So the group in the blue light therapy, morning blue light therapy, was falling asleep on average of 1 hour earlier every single night. And the group in the amber light was falling asleep actually 15 minutes later by the end of the 6 weeks. So it had basically no effect. But the blue light group was falling asleep 1 hour earlier. Blue light group was also waking up 1 hour earlier. So it basically effectively phase shifted their entire sleep cycle to be 1 hour earlier. The amber light group was actually waking up 16 minutes earlier. So they were falling asleep 15 minutes later, waking up 16 minutes later or earlier. Their overall sleep had actually contracted, whereas the blue light group, their overall sleep had actually just shifted over. The blue light group reported reduced daytime sleepiness. 87.5% of the blue light group showed reduced sleepiness scores from pre-intervention to post-intervention. The conclusions of this particular study, our findings are consistent with well-established evidence that blue light exposure affects the timing of sleep-wake cycles through stimulation of the retinohypothalamic system. So that's your system where your eyes are connected with your hypothalamus to release certain chemicals and compounds to allow you to sleep or be awake.